Good morning, everyone. Welcome to another episode here at Doctors of Podiatry. I think this is an extremely important case because I think there's a couple of maybe people that were a little confused on the minimally invasive case that we recently did that I presented on our social media platforms. The patient, this is 2 days after the procedure that was done here in our office-based surgical suite, but I really want everyone to understand what we did and why we did it. There's something called pre-dislocation syndrome, just like I explained to everyone before. In the world of hammer toes, there's sometimes the toe will start to move outside of the joint. And when that happens, right, if this is normal, again, this is what starts to happen, right? The metatarsal head, right? And this is the hammer toe developing. We'll just say it's kind of like that. This is what happens. So the skin is down here. And the problem is that the skin, right? If the metatarsal continues to move in a downward position, it's going to lead to pain, because in this particular patient, who's an 84-year-old young patient, right? A young 84, he does not have fat. And fat plays a major role in the biomechanics and structure of how we walk. He has no fat at all. So what we did, my recommendation to him was, let's bring, right, the toe back to its normal anatomical position, right, back into the joint, and that will move the metatarsal that was here to here. So we have basically just realigned the joint. So now, you know, when people may have been looking, I don't know, again, I'm assuming, and I don't like to assume, but if people were looking at the before and afters pictures and they saw that the patient still had the hammer toe deformity, it's very important for people to understand, we only treat the problem. We don't start nitpicking at different things. In this case, the bump. The bump was never bothering the patient. Again, if it ain't broke, we don't fix it. So the patient, and I asked him point blank, is the bump bothering you? No. Is the bump rubbing against the shoe? No. What bothers you? This is what bothers me, Dr. Wagner, on the bottom. So we did not shave the bump. We did not align the toe and put a wire, or whatever the case may be. We did not do that. So we only focus our efforts on the primary problem, and that's exactly what we fixed. I can now look at the, I want everyone just take a look. Let's go first from the top. So when I load the foot, right, this is kind of what the patient, when the patient is weight bearing, the toe before, this bump was up here and it dropped all the way down there. That's a lot. So I'm very happy because now when I press on this, right, now there's a cushion. I don't feel the bone pushing down on the skin. And even today, 2 days after, the patient already told me it's feeling better, right? So, you know, this is, how do we define success? This is a successful, minimally invasive procedure. Like I said before, the patient was never concerned about aesthetics, that the toe appeared ugly. This was about function. So, you know, after I posted the previous before and afters and the video, I had this this feeling that there might have been some maybe confusion, and this is why I'm putting this video as well, not only for people to see what 2 days, there's no swelling, a little bit of bruising, right? A little bit of bruising. No signs of infection. Everything looks really, really good. We usually use 1 stitch. In this particular case, we just decided to use 2. But again, you know, it's wonderful. This is great. Now you see, look, I don't feel the bone. Now I feel just a pad. And that's what we want. We want that pad. So I really hope this has been more of a clarification type of video. I think the patient's going to be absolutely thrilled in about, I would say in about a week or two. Once he starts ambulating and getting back into to his normal daily life activities, he's going to be thrilled. He's going to be really, really happy. And like I've always said, happy patient, happy doctor. So like always, thank you for watching. www.jawspodiatry.com, Facebook Jaws Podiatry, Instagram Dr. Toe Jam, and our YouTube channel. We're going to also post this on our YouTube channel because a lot of our viewers there were asking some questions about the case as well. Have a wonderful weekend, everyone. Thank you for watching.